Welcome to What's Now. I'm your host, Christine Napier. This is a show where we talk about what you need to know, fun products that you need, your health, and much, much more. And especially this show, we are going to focus on your health, about many things from cancer to Medicare and much, much more. And up first, we are going to focus on Medicare. What do you need to know this time of year, especially as we head out of the pandemic? What is important to focus on? We have some information for you right now.
While prescription drug costs continue to be a concern for many, there are ways people can and should be using their Medicare benefits to save money and support their well-being. Joining us now to discuss some tips on getting the most out of your prescription drug coverage is the CEO of Pharmacy and Part D for UnitedHealthcare, Mike Anderson. Mike, thanks for being here.
Thanks for having me.
What should people enrolled in Medicare know about prescription drug coverage?
So probably the first thing to know is if you're in Original Medicare doesn't cover prescription drugs. You have to buy a policy called Medicare Part D. That's the part of Medicare that covers prescription drugs. There's two ways to get it. One is that you can buy what's called a standalone Part D plan. That's if you want to use Original Medicare and just have pharmacy coverage in addition to it. Alternatively, you can buy something called a Medicare Advantage plan. This is becoming a more popular option. That Medicare Advantage plan covers both your medical and your pharmacy all in one plan.
Do you have any tips for how people can more easily access and afford their prescription medications?
I do, and I get that question a lot. In terms of tips that I offer people, if you're a Medicare beneficiary, you have prescription drug coverage, it's worth checking if your health plan offers home delivery of your medications. Very often, using a home delivery pharmacy will save you some money on your prescription drugs. We've also found during the pandemic that it's super convenient just to have your medications delivered right to your home, so you're not missing doses, being unable to get to the pharmacy or something. Second recommendation I would give you is to talk regularly with your doctor about your medication list. There are many medications to treat various conditions. Often your doctor can select something that might be lower cost if you're having trouble affording it, so that's worth a conversation. And then the third thing, if you're struggling, is you can call your health plan. That number is usually on the back of your ID card. You should be able to reach a knowledgeable associate who can help you navigate and make sure you're making the best use of your drug coverage.
The prescription drug landscape is very complex. What resources would you recommend to help in understanding prescription drug coverage?
You know, it really is complex. There are some good resources, though, that I would offer. Medicare.gov, actually, that's Medicare's website, has some pretty good resources, especially if you're shopping for prescription drug coverage. They have something called a Medicare Plan Finder. Plan Finder allows you to enter the medications that you take, and it'll price different health plans for you that are available in your area. The thing that I always caution people on is it's really tempting because it is complex. It's tempting just to take the lowest premium and buy it. That may not ultimately be the lowest cost. You may have a low monthly premium, but your drugs may not be covered, or they might be covered at a high copay. So it is important that you're looking not only at the premium, but the coverage that the plan offers as well. So Medicare.gov is a good place to start.
Anywhere else we should go for more information on this?
Yeah, another one is my company, UnitedHealthcare, has pulled together a lot of really good resources. The website for that is uhcmedicarehealthplans.com. Good resources there as well.
Perfect. Well, thank you so much, Mike Anderson, for joining us today for this important discussion about prescription drug coverage and Medicare. We appreciate it.
Thank you.